Adrenals and its diseases. So adrenal hormone is actually regulated by the hypothalamus-pituitary axis. The hypothalamus in the brain releases the corticotropin releasing hormone, which is the CRH, and this will induce the pituitary gland, the anterior part, to produce the adrenocorticotropic hormone. The posterior part of the pituitary gland is mainly to produce the ADH. So the anatomy of the adrenal. The adrenal cortex consists of three zones, which is glomerulosa, fasciculata, and reticularis. The glomerulosa is important in a mineralocorticoid pathway, as it will produce aldosterone. Aldosterone will act at the renal, especially the distal convoluted tubule, to retain the sodium and the water, and will secrete the potassium from the blood. While the fasciculata, the zona fasciculata is called glucocorticoid pathway, and will the end product is cortisol. Cortisol is important as also it's also called stress hormone. It mainly increases the glucose production. The reticularis is the androgenic pathway, which produces the sex hormone, which is mainly important in the female, as the male has another testosterone producing organ, which is the testis. The medulla part of the cortex of the adrenal gland is actually important in the fight or flight response. So they have sympathetic nerve, which in response to the stimulation from the brain will cause the production of the adrenaline and noradrenaline. So this is in summary the function of the hormones produced by the adrenals. The aldosterone is mainly for salt and water homeostasis. Deficiency causes adisynesthesis, while the excess will cause hyperaldosteronism. Cortisol is important in glucose fat metabolism and also in for acute stress response. The excess of cortisol causes Cushing's disease. For androgen hormones, is actually important for the formation of the pubic axillary hair, actually for the maturation lah. And while the catecholamine is important in maintaining the blood pressure. So actually the cortex of the adrenal is mainly 80% consists of the zona fasciculata, which produces the cortisol. So cortisol is a lipid soluble hormone, which is a glucocorticoid, and is not soluble in water, and it is actually bind to a cortisol binding globulins. Only 5% are free. So this free fraction is the actually biologically active cortisol in our body. So this free cortisol is actually part of the circadian rhythm, in which the cortisol level peak in the morning and drop in the evening. In stress, cortisol will induce the gluconeogenesis, which increase the glucose production, increase proteolysis, and also lipolysis. Cushing syndrome is actually an endocrine disorder with elevated cortisol levels in the blood, described by Mr. Harvey Cushing. So Cushing disease is actually if it results from the pituitary adenoma. So this cortisol maintains blood pressure. It increases sensitivity of peripheral blood pressure to catecholamines, which is epinephrine and norepinephrine. But it also dampens the inflammatory and also immune response. So it will cause immunosuppression. And it also has some function in the brain, as the brain has cortisol receptor and may influence in the moods of the person. So this level of free cortisol have to stay in normal range. So this is actually regulated by a negative feedback. So if the level of cortisol is high, it will give a negative feedback to the brain and reduces the CRH and the ACTH production. Cushing syndrome is when the cortisol levels are constantly higher than normal. It causes the severe muscle, bone and skin breakdown, and also will elevate the blood pressure and cause truncal obesity. Cushing syndrome also can cause hypertension, as it not only amplify the effect of catecholamine, but it can also cross-react the mineralocorticoid receptor, as it mimics the mineralocorticoid. So it also inhibit the gonadotropin releasing hormone, so it mess up with ovarian and testicular function, and also dampens the inflammatory response, so the individual is more susceptible to infection, and also may impair the normal brain function, like causing mood disorder. So the other causes, like exogenous, is when the excess steroid consumed from outside. So these are usually medications that has been taken in a prolonged time, like for treatment of autoimmune and inflammatory disorder like rheumatoid arthritis or asthma, and also nephrotic syndrome. Similar to it is actually similar to cortisol. So it will cause the negative feedback to the brain. So this negative feedback will cause decrease in CRH and ACTH, and this will shut down the cortisol production in the zona fasciculata. This lack of stimulation will finally cause the adrenal gland to shrink and finally will become atrophic. Endogenous cortisol is actually made by the body, like pituitary adenoma. This is called Cushing disease or excess of ACTH. This will then overstimulates the zona fasciculata. So causes of the endogenous, other than the pituitary, is actually tumors of the carcinoma of the lung or tumor of the adrenal gland, like adrenal adenoma, which is benign, or adrenal carcinoma, which is malignant. This will cause cells in zona fasciculata to divide abnormally and secrete excess cortisol and suppress CRH and ACTH production. So the adrenal will shrink, but the net level will still high. So the symptoms of Cushing disease directly relate to the effect of excess cortisol on tissues. There will be muscle wasting and the thin extremities. The person can have easy bruising, abdominal striae, fractures due to osteoporosis. They will have hyperglycemia, which can lead to diabetes mellitus, hypertension, increased cardiovascular risk, and also increased vulnerability to infection, and causes poor wound healing. The person will have a characteristic moon shape, buffalo hump, and also truncal obesity. To diagnose, we actually have to measure the free cortisol in a 24-hour urine sample. So this will assess the total amount of cortisol excreted in urine over 24 hours. Other than that, we can also do a serum or saliva test of the cortisol late at night, which this will we can see the normal daily rise and fall of the cortisol. For the DEXA suppression test, this test is done by giving low dose of dexamethasone, which is exogenous steroid. This is supposed to suppress the ACTH production and should cause the decrease in cortisol level. If the cortisol is still high, this means we can determine the cause of endogenous cortisol production by actually measuring the ACTH. So when we measure the plasma, the serum ACTH, if it's low, it means that adrenal adenomas or carcinoma causes the Cushing syndrome. If the ACTH is high, this may mean that it is actually caused by pituitary Cushing disease or ectopic ACTH production like lung carcinoma. So we gave another injection of dexamethasone if ectopic site is the cause of the high ACTH. Usually it will not respond to the injection of the DEXA. So we can also do imaging to look for like MRI of the pituitary, CT scan of the adrenal to look for any abnormality, CT scan of the chest to look for any lung cancer or abdomen. So the treatment depends on the underlying cause. If it is caused by exogenous, the exogenous medication, the drug is should be gradually decreased. We should avoid a sudden cease of the drug, which cause withdrawal and ultimately adrenal crisis. If pituitary adenoma, we should do surgical excision and adrenal steroid inhibitors like ketonazole or metyrapone. This is used in the ectopic ACTH production or adrenal carcinomas. So, in a nutshell, Cushing disease is actually caused by increased level of cortisol, and it can be caused by exogenous, which is drug related, or endogenous, which is caused by adrenal tumor or excess ACTH. For excess ACTH, it could be Cushing disease if there is pituitary adenoma or pituitary tumor, or it can come from ectopic site like a small cell lung cancer.